History repeats itself. Let me say that again. History repeats itself. And those who don't understand and remember history are destined to repeat it. As Churchill said, those that fail to learn from history are doomed to repeat it. Did I say repeat enough times? He said, however, that we must learn from our mistakes. And if we don't learn from history, we are destined to make those same mistakes over and over again. And I feel like that's kind of deja vu for me because, I've been doing this for a long time. And when I started, there really weren't a lot of options for us except surgery or no surgery. And there really weren't any fillers. And all of a sudden, we started using fat injections. And the very first filler that we worked with was called collagen. Strange enough, right? And it was from a cow, bovine collagen, and it created, an antigenic response. So our body broke it down very quickly. So it didn't last very long, but it was a filler. And as other fillers came along, the first one after that was a filler called Radiance, which later became Radiesse, and is still around today. And then Restylane came on the market, and then, everything has exploded ever since. And this was, the early 2000s I'm talking about now, so a while ago. Sky Skin Center, Hatay, our favorite. Thank you for joining. I'm just talking a little bit about how history repeats itself, and I'll say that again. History repeats itself because if we don't learn from history, if we haven't understood the historical context of what we're doing, we're doomed to make all the mistakes that everyone else made before us. So part of history is learning about what worked and what didn't work. And I was thinking about it today, that when we first started using fillers, fat, mostly collagen, then Radiesse and Restylane, we over-injected everyone because when you have a hammer, the whole world looks like a nail. And if that's your only filler, you're going to try to repeat everything you see in aging with a filler, and we were doing nasolabial folds and lips at the time. That's pretty much all we did because everyone saw this happening. And everyone said, oh, we got to fix this. We got to fill this up so it was like this. Everyone tried to efface it by just adding so much volume that everyone looked like an ape. No disrespect to apes, but, not a human form. Not a natural look for a human. Anything that has a animal's name attached to it, like fox eye or bird's nose or, cat, anything that has an animal associated with it, to me, that's not a natural human trait. And I don't know why anyone would think it's attractive to have your eye look like a fox or whatever. We can talk about that later. But those who don't understand the history of this field are destined to repeat all the mistakes we've made for all these years. And because, when we started filling patients, we didn't understand that there were limits. We didn't understand normal proportions in faces. We didn't understand the balance between the middle, upper, and lower third of the face. So we were just randomly injecting, right? So in a way, we were just technicians, right? We were just saying, oh, here's a product. Here you go. And here's how you do it. So everyone was just doing it, just like a technician, like, oh, I can do it. And I see that kind of nowadays with lips. It's like, okay, like here's an overblown, crazy looking lip. So everyone's going to try to duplicate that without any regard or thought to the history of lip injections, which I lived through, right? So we were injecting lips, we were putting fascia, we were taking temporalis fascia from people's heads, we were putting it in lips, we were taking palmaris longus tendons and putting that in lips, we were taking dermal fat, we were taking dermis skin, dermal fat grafts, which we de-epithelialized and putting that in the people's lips, we were putting Gore-Tex grafts in lips, we were putting pieces that look like ziti in the lips, we put everything you could put in a lip. And then we realized that, that's not a natural thing. And that was after, doing that for 5 or 10 or whatever number of years and thousands and thousands of patients. So, we've learned that lesson, I thought, because when people were sort of overdoing this to lips and blowing up lips. Hi, Kate. Good to see you. Hello, Christina. Almost barbaric, she says. Yeah, well, the history of surgery, the history of aesthetics is barbaric. Barbaric things, like most plastic surgery advances, like the biggest advances, were all based upon like people being blown apart or cut apart, or being in a war, the Vietnam War, other wars where people lost limbs and lost big pieces of tissue and lost all these things. And plastic surgery was forced to stretch its mind and advance. And even in the days of Tagliacozzi in the 1300s, where they were like doing these forearm plasties, where they're taking people's forearms and sewing it to their head and then cutting the tissue and leaving the patient like this for a week or two, and then cutting the tissue off and letting it stick, or reconstructing people's noses that way. I mean, they understood. It was horrific. It was barbaric. Hello, Larissa. I think you're going to become a regular on this show. She was one of our students a couple weeks ago, and she's with us 2 weeks in a row, so thank you for joining. Yeah, it was a little bit barbaric, Christina, but that barbarism, that like crazy, awful thing, created a need, and necessity is the mother of invention. So when something terrible or bad happens, you're forced to stretch your brain and say, okay, how do I use what I know? How do I use what I've seen? How do I use what history has taught us? Because, history repeats itself. I'll say that again. History repeats itself. If you don't understand it, you're doomed to have the same errors and mistakes that have existed for centuries. So learning from your mistakes, is obviously very, very important. But learning from other people's mistakes is kind of even more important. That's what my focus is on. It's like, I want to teach you about all the mistakes that I've made and that I've seen made, that I see being made every day, to try to keep you at a higher level, to try to keep you out of that minefield and out of the mud, out of the dirt, so your patients get better results and you get the ability to build a better business and have more confidence. But, when we started over-injecting these patients, we thought it was great, but then what happened? What do you think happened to the patients? Hello, Courtney. Long time no see. Good to talk with you. What do you think we started to see? People started saying, I'm really nervous about doing my lips, because everywhere I go, I see people with these crazy lips. I don't want to do my lips. I'm like, oh, no, that's not what I do here. Well, like, I look at your nurses and I don't want to look like that. Oh, no, you don't understand. I didn't inject them. They injected each other. So patients became incredibly phobic about actually having their lips done, because, listen, you don't have to be a rocket scientist to look at someone and go, oh my God, their lips are too big. Like, that doesn't make sense based on their face. And you start looking at them like, what's wrong? Because in general, your eyes are very good at looking at someone's face, and within less than a second, focusing on what doesn't fit. Like, their nose is too big, their eyes are too small, their brows are too high, their lips are too big, the lips are too small. Well, whatever it is, like, your eye does this analysis very, very quickly, because it looks at millions of people, right? And it knows what the normal range is and what the abnormal range is. And when it sees the abnormal range, which is hopefully far less often than the normal range, your eyes just stops and goes, what's that? What's wrong with this picture? Those old books we used to look at when we were kids. What's wrong with this picture? And you used to have to circle what was wrong. Well, your eye kind of does the same thing automatically. It looks at someone's face and goes, what is wrong with that face? What is that face that's so puffy or so round, or this flying saucer face where everything's in the middle, or that pillow face, and it can identify it very quickly. So the lesson that we learned a long time ago was that less is more, right? Like, if you look at someone and know they've had filler, history repeats itself. Let me say that one more time. History repeats itself, because if that is something that you see and you aren't sort of addressing it, and people are walking around with these faces that are full, overly filled, and everyone's looking at them going like, what's wrong with them? Who did that to them? And they say, oh, that must have been Brittany. She's the last person on the list. So I'm never going to go to Brittany because she makes everyone look like that. And of course that certainly isn't true, but that's the kind of thing that happens. And you lose patience, you lose credibility in the industry, and we go through this cycle again. And I thought that we had broken the cycle, that the people had come back from that huge lip era and kind of come back down to that sort of, let's make people look normal era, but still look good. But if you look at someone and know they've had filler, to me, that's not good. That's not normal. And if you do something that's attached to an animal's name, like a fox eye or a cat eye or a dog, why are we putting animal characteristics on people's faces? That's not human. It can't be normal. It can't be good. Why are we calling it that? Like, why are we doing that to people just to make them look weird so we can say, oh, we made someone look like a fox face? Like, I don't know where that came from. But I can tell you that after living through this for 30 whatever years, these things keep recurring. They keep recurring, and everyone thinks, oh, I've got this new product, let me make people's lips bigger. And I think the reason is that every time old people like me leave the industry, and new people come in to replace us, they keep making the same mistakes that we made 30 years ago. It's like there's no learning, there's no changing, there's no like, okay, this is how you do this. Don't overfill a lip, don't overdo this. And I don't know how to fix it because there's so many new people coming in. There's so little available excellent training. By the way, if you want to train with us and learn about all that stuff, look at the link in our bio. We're Aesthetic Mentor. We have schools in Connecticut and Massachusetts and others to follow, I think. But anyway, you go from starting out as a technician, like here I have this product, let me inject it, to becoming I'm going to call it a specialist, but maybe I'm giving people too much credit, to saying, I really like this product, I really like treating the lips or whatever it is, to becoming an expert. Okay, so now like I've done a lot of this stuff and like I have a better sense of like what makes people look right, and I really do a lot, to actually becoming the highest level, which is an artist. Because it's all about, okay, I've got this array of tools in front of me, this palette of colors, this, smorgasbord of ideas and technologies. How do I use them? How do I apply them to these patients to create beauty? Because we don't want history to repeat itself. We don't want history to repeat itself. We don't want history to repeat itself. I know I'm repeating, because I don't want history to repeat itself. Because once you have gotten to the level of artisanship, and we should all strive for it, because I think, when I look at pages of on Instagram, which is one of the few things I look at, but I'm getting really disenchanted with that too. I'm just getting bored by it. All I'm seeing is pictures of like 0 to 3 month old kids, and like that's not why I'm looking at Instagram. Like I'm not that. That should be on your private page, not on your professional page, in my opinion. However, what happens when someone says, I want to be in your live video? I don't know. I don't know how that would. So when you get to the level of artisanship, where you're sort of looking at people going, okay, how do I make them beautiful? How do I choose from this array of things I can do for them to make them look more natural? I'm not just going to always pump their lips. I'm not just going to always do this. I'm not going to always do that. I'm going to look at them and go, okay, let me do my analysis, right? Let me do my analysis of that patient's face and determine what they need, right? So they may not need their lips done, and you may be thrown off by that. Like, how can I treat a patient without treating their lips? But believe it or not, there are people who actually have lips out there that are beautiful that were never treated, and they don't need it. They need their temples or their jawline or their brow or whatever it is they need. So, we have to look at them artistically and say, okay, where are the gaps here? Like, where is the beauty? Everyone's got the beauty. How do we enhance that beauty? How do we put the proportions together? Where do we enhance it? And that's really what separates everybody. And one of the classes that we teach about assessment really does nothing except just continually force your eye to see what's there, to see the big side of the face, the small side of the face, the high brow, the low brow, what side of the lip is bigger than the other, which side of the jaw is bigger, which ear sticks out more, whatever it is. Because you're only as good an injector as you are an assessor. If you can't assess a patient correctly, how can you treat them? If you can't identify the problem, how can you correct it? How do you know you're not making it worse, right? Are we blind? So vision is really hard, but the artistry is what I'm talking about. Oh, Kate, the best thing I learned in cadaver class through the assessment, right? And I bet, tell me if I'm wrong, I bet that changed the way you looked at patients forever. I bet that after that class, you started looking at people saying, oh my God, like I can definitely see which brow is higher. Oh my God, I can definitely see which cheek is fuller. Oh my God, right? If I'm right, let them know that that's true. So a technician is someone who has a page on Instagram and all they have are lips. And all they're saying is like, hey, no matter who you are, what you look like, whatever you are, I'm just going to keep filling you up as big as I can make your lips. And that's what I do. And if you're attracted to that, I feel bad for you. I'm sorry for you. And if that's what you're aspiring to be, that doesn't take any talent. Sorry, that doesn't take any talent. The next level of being a specialist is like, hey, it should be required. You know what? It should be required yearly in every class. Yeah, and aesthetics. Yeah. So, we are probably just going to have a separate course on that, Kate, and I'd love you to be part of that if you want to teach it with us, if you want to be part of the school. because it's hard. It's really hard. It's really hard to teach. But once you get it, you'll never unsee it. Like, by the end of the class, people are like, I can't believe I didn't see that before. Like, people will look at a face for 15 or 20 minutes, they don't see it. And finally, when they see, like, which brow is higher, you force your eye to make your brain say no. Your brain wants to say everything's symmetric, like both sides of your face are equal, your eyes are the same height, your cheeks are the same height. We know they're not, right? So when you finally get your brain to be sort of subservient to your eyes, you win. And you see it every time after that. And after a while, you see it from across the room. You're like, oh my God, look how high that brow. So it takes training. So technician, anybody, specialist, I have an interest in this area. Expert, and maybe I'm using the term loosely, but expert's like, I really like this. I've been reading about it. I'm looking at what other people are doing. I'm thinking about it all the time. I'm trying to get better. Then artist is like, I've achieved. I look at faces and I try to create beauty from those faces, but I don't want anyone to know. So when someone looks at my patient, I want them to say, oh my God, like, you're so beautiful. Like, everything just works. Like, where's my filler? Do you even have filler? Like, I don't know. Like, what? You just, it's all a natural beauty, and natural beauty is way better than manufactured beauty, because if you're not at the artistic level, if you don't know the proportions and the angles and what makes people beautiful, you're just kind of flailing. You're just kind of making excuses. You're just kind of out there taking people's money without delivering the results that they need. So that's a sad statement. But that's why history repeats itself. That's why history repeats itself. That's why history repeats itself, because we aren't learning from what's happened in the past. And all these new injectors are learning from Instagram or YouTube, University or wherever the hell they are. And they're just trying to mimic something that is terrible. And that's why we decided to do what we're doing, because we believe that we want to be the gold standard in medical aesthetic education. We want to break all the sort of, urban legends and all these sort of trendy things that don't work or that make people look worse. And we want to teach you the history of aesthetics and say, like, blowing people's faces up, and particularly with their lips and cheeks, is a terrible thing to do. It's not aesthetically pleasing. It makes them look like pariahs, and everyone looks at them not because they're attractive, but because they're unattractive, and their proportions don't work, and your eye won't stop looking because it's like a car crash. And it's trying to help the person. Like, oh my God, what do I do to help this person? So that's my little soapbox speech for tonight. So how do we treat these patients once we see them, right? Because if we don't learn from the past, if we don't learn from our mistakes, we're destined to repeat those same mistakes. And it's just going to keep happening over and over and over again. It took like 30 years for this to cycle. When I first started, like, everybody blew up lips and everybody got afraid. Everyone was just like micro-treating lips. And now we're kind of swinging back to the, oh my God, everybody's terrible lips. And now we're starting to come back. We're drifting back down to reality. We're getting, the effects of gravity are pulling us down to reality. And hopefully we're getting smarter. And hopefully you'll listen to people who've been in the industry for a while and have seen these things happen and are seeing them happening again. It's just really distressing to me to see it happen. But when people come in and they're overtreated, you don't have to be mean about it, but you need to be honest with them and just say, you've been overtreated. Your lips, your cheeks, your whatever it is are too big. Your jaw, you're out of proportion. This is what a normal patient looks like. This is, and don't be afraid to dissolve it. Don't be afraid to just say, look, we need to start over. We need to build from, your natural beauty, and we need to do a little bit at a time. And we're not going to do 12 or 15 syringes at once because we have no idea what that's going to look like. We're going to do 2 or 3 and start creating beauty, because I want you and I to be on the same page. I want us to be simpatico. I want you to like it as much as I like it. And if you try to force me to do more than I want to, I won't do it. I'll discharge you as a patient. Because I don't want to create something that isn't going to look natural. And if I do, I'll be the first to say, you know what, I don't think that looks great. I'm going to try again. It doesn't happen often, but it happens, right? Because we're all just human. Don't be afraid to dissolve it and start over. And believe it or not, you'll be happy you did it. And so will the patient. One of the big problems I've seen, and it sort of happened, it kind of awakened my awareness of why people are overcorrecting. There was a period of time where the companies would give us product, and each of the nurses could treat each other, and they kind of had an unlimited product. So they would just treat each other, and they would go a little crazy, because it's like a kid in a candy store. Like, you just eat so much you end up just puking, right? Because you just like, the candy's free, and why would you stop eating it? Well, the products are free, why would you stop injecting them? Kind of the same thing. So after a while, like, the nurses were so overtreated that my patient started saying, I don't want to look like your nurse. If you treated your nurse, I'm like, no, I didn't. It was like they treated each other and blah, 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 blah. And after a while, I had to say, okay, team, hem out, no more filler. No more filler. You're all overdone. You're making us look like a bunch of zombies, and that's it. So they finally kind of realized it. Then I started dissolving them, and guess what happens? Like, when you've been over-distended, if your tissues have been over-distended for a long time, and you're creating all this additional collagen production, you know, your faces are really kind of chubby and overdone. It makes you look fat and awful. Your tissues, after you dissolve them, guess what happens? Your face kind of melts like this, and you look terrible. You look even worse. Because your tissues are stretched out. Like, think of like a woman who's been pregnant for 9 months, and then they deliver. What does their abdomen look like? And oftentimes, it never kind of gets back to where it was before. And that's why plastic surgeons do so many tummy tucks and so many breast lifts. Because when tissues become over-distended for whatever period of time, depends on your biologic makeup, it don't come back. It don't come back. So thank God. That's why God invented plastic surgeons. Hello, Carmel. A little late to the game tonight, but never too late. Thank you for joining. We moved surgery back to 8:30 tomorrow, so don't show up early. Well, she'll show up early anyway. Never mind. Show up whenever you want. So don't be afraid to dissolve it. Don't be afraid to be honest with patients, and don't go along with patients that ask you to do more than you think is reasonable. And don't do anything to someone's face that has an animal's name associated with it, like a cat's eye or a dog's ear or a cat's eye or a pig's nose. Don't do anything with it. Don't put animal features on humans' faces. Please. Don't do it. And thumbs up. Please don't do it. And please try to learn from history, right? Please try to learn from others who are like as old as I am or somewhere close to me who are telling you, don't do these things because we did all these things and they're terrible things to do to people. And if we keep, trying to reinvent the wheel, all the failures of history keep repeating itself and repeating itself and repeating itself. We're on that same cycle again. So please try to learn from the history of aesthetics. And if you don't know it, then read about it or ask someone old like me, like what to do. Remember, when you're treating these patients, go from the technician level, which is like, I'm just injecting it, I don't know where, I don't care, but I know how to inject it, to the specialist level where you're showing some aptitude and interest, but you're still not really very good at it, to an expert level where you're sort of like, you've done a lot, you know a lot, you're trying to learn more, you're trying to get better, but you haven't gotten to nirvana yet, and then you become the artist. As Carmel would say, you become the artist, and you put it all together, and you realize that most of the people out there, like almost all the patients you see on Instagram, are dramatically, horribly overtreated, and if you're putting it up there to show people how proud you are of your work, you have no clue what you're doing. If you're blowing up people's lips and putting that up there as something you're proud of, you have no idea what you're doing. You should go back and kind of get all the product out of the patient and start over. That's why I enjoy taking repeat classes. You know what? That's a very good point. That's an excellent point, because when you learn something, like if you come to a cadaver class or any kind of class, you only retain a small percentage of it. Like when I go to these courses and I'm like, oh, this is like a great thing, I never thought of that, I probably retain and use 5 to 8% of that. Like it sounds great at the time, but then you have to integrate it into your practice and like figure out how I'm going to use this new theory, this new knowledge. And it's a slow integration into your, and actually it should be. If you're doing good work, you shouldn't like completely change what you're doing because someone else is doing that, but you should listen to what other people are doing, be critical of it, and see like, you know what, does that make sense? Do I want to try that? Do I want to do something like that it makes sense to me? And use that little chemical formula and sort of figure out, that each time you go to one of these things, make yourself a little better. And as Tracy's pointing out, repeat classes, like cadaver class. Like every time you go to one of our cadaver classes, you'll learn more. But also the course changes. Like change it a little bit every time based upon what I'm seeing happening in the world, of the world of aesthetics. And and each patient, each cadaver is different. Each bit of anatomy is different. And learning it, each time you learn a little bit more and you become better and better. You can't go to one class and say, I'm an expert in anatomy. I took a cadaver course. I mean, that is a very dangerous thing to feel, right? You think to yourself, when I first went to my first cadaver course, I was very humbled by it. I was very thankful that I hadn't killed anybody. Like, I was like, Jesus, I didn't realize all this stuff. And like, I didn't realize how close I had come to these artists. I didn't realize how easy it was to blind some. I didn't realize any of these things. And afterwards, I was very humble. And that's why I created these techniques, these safe injection techniques that I teach all the time, because I know how easy it is to hurt somebody. We had 2 occlusions in the past 2 weeks, lips. We've seen probably 60 now. I don't even know. And it's always the same issues. It's always the same breaking technique. It's always the same, So that's why I invented these techniques, to keep you safe, to keep your patients safe. Honestly, to keep the industry safe, because I want us to all be doing this, and I want us to evolve, and I want us to become better and better. But it's hard when people are blowing people's faces up and not even understanding or realizing how bad that is. So history repeats itself, and if you don't understand the lessons of history, you're doomed to repeat them yourself, and it just keeps going like this, So be above it. Strive for that artistic level, the level of artistry that you understand proportions, and understand that less is more, right? And as I said before, if you look at someone and say, gee, that's some pretty nice filler you got there, that's bad. Like, if you look at someone and know they've had filler from across the room, how is that a thing? How is that a good thing? Like, to me, that's repulsive. I feel bad for the patient because they think they look good, I think, and they wouldn't keep going back to that provider. But we as providers have to be held to a higher standard. If we're creating things, if we create things that aren't good, shame on us. But if we don't know, if we haven't stuck our necks out and made our brains stretch and try to learn how to be better, you won't be. You'll just get worse. And then new things will come along and you'll try them and you'll blow up something else on somebody. And that's just not what this industry should be about. We should be better than that. We should hold ourselves to a higher standard than that. And I don't care what people are doing on any, social media sites, whatever. Forget about that. Just look at the person in front of you. Just look at a normal person that's attractive and say, why are they attractive? And just look at someone next to them who's got too much filler and go, well, now I see why they're ugly. I see why they tried to make them better, but they didn't get it. They didn't understand it. And they missed completely. And, just look at anyone in Hollywood. Look at, when they were, what they looked like 10 years ago and what they look like now. And they all look worse. They all look horrible. And, they more is better for them. So my goal tonight is to make you all, can you please have a topic specific to treating occlusions? Yeah, for sure. You want to do that next week? I'm going to be at an Allergan thing next week, so I'm going to have someone do a steal for me to talk about occlusions. Yeah, that's, honestly, you shouldn't be doing the treatments if you don't know how to treat an occlusion. I mean, if you can't treat the complication of surgery, like, what we say in surgery is like, if you can't handle the complications from this procedure, you shouldn't be doing it. Like, if you don't know how to get out of trouble or how to fix it, don't do it, right? And there was a TV show called Beretta, and he said, don't do the crime if you can't do the time. Like don't try, make sure you know how to do it. So yeah, occlusions are important. Occlusions are very important, and I'm happy to go through that. It's not rocket science, but you see people over and over again making the same mistakes, both in terms of how they're treating the patients and getting the occlusions, and then in recognizing the occlusions and treating them, both ways. Sometimes people have a bruise and they think it's an occlusion. Sometimes people have an occlusion and they think it's a bruise and they don't treat it. And sometimes people just don't know what the hell they're doing. They leave it alone and tell the patient, everything's good. A mock occlusion? What's a mock occlusion? What do you mean? Like make believe someone has an occlusion and show them how we would treat it? Yeah, that would be kind of cool. Yeah. Yeah, that's a really good idea, actually. Let me think of that. Maybe I'll put Brittany on it next week. I don't know if she's still around. But I think that's good. We actually thought about doing one of these where I actually showed you my safe injection techniques and treated a patient. But maybe that's even more important because Occlusions are obviously can be critical, and we need to talk about how to do it, the philosophy, what products to use. But even more important than that, how to inject safely. That's what we're all about. My safe injection techniques are designed to kind of keep you and your patients out of trouble. I'm kind of all talked out. Is there anything else you want me to answer? You think the occlusion thing is a great idea? Medical skin? Yeah. You know what? I'll put that on the docket for next week. Brittany, who's on this, she was on this call, does a lot with me in my office, and I may put her in charge of it. She knows my philosophy. She's treated a lot of them with me. And of all those occlusions we've had, Kate, you're welcome. Of all those occlusions that we've had 2 permanent ones where the patient had permanent tissue loss, both around the mouth, both first-time patients from 2 nurses. One was a good nurse, one was a bad nurse. I'll tell you more about it when we do it, but they were both delays, very significant delays in diagnosis and very significant delays in treatment. And, tissue can only go so long without blood supply, without oxygen. None of us can go very long without oxygen. So it's important to recognize it and treat it aggressively, and you'll be fine. The other, let's say we've had 60, the other 58, we're all treated, pretty quickly, pretty nicely, without any significant long-term sequelae, certainly no significant necrosis or anything like that. So it can happen, and we'll talk about that. So medical's going to send a request. Yeah, you know what? Medical skin. Why don't we do a live together?
Send an email.
Send an email to me.
Anyone who wants to join.
Well, I'm happy to do a live with someone else. I think it's actually more fun, and your followers and my followers.
Some time in advance. We just can't do it.
Yeah, just give us a little. Just email me, and we'll give us your information, DM me or whatever. Give me your email information. We'll try to set up a time, and we'll do a live together. I like doing lives with other people. It's just more fun. But we'll find out what you do and how you do it and what your thoughts are. So anyway, I'm probably not going to be here next week. I'm going to be at an Allergan thing, I think. But I will try to set up the occlusion thing for you because I know there's a lot of interest in that. And it's really critically important to know. And don't do the crime if you can't do the time. All right, guys. See you next week. Have fun.